acupuncture and traditional Chinese medicine have proven to help regulate hormones and regulate the central nervous system, and those are two of the most important things when you're going through preconception care and trying to get pregnant. There's a huge stress component, which it helps to decrease stress. Acupuncture acts to help encourage homeostasis in the body and more effective function in the system, cellular function and systematic function. So what's nice about it is Western medicine will measure the blood work and give us some specific information about, oh, maybe the estrogen's too low, or there's an issue with egg quality, or there's something going on with the lining. Then acupuncture can kind of, without even really knowing that stuff, help the body make more estrogen or less estrogen. It just brings it into homeostasis. So say someone's coming in for 3 or 4 months of preconception care and their ovulation's off, they're having really irregular periods or really painful periods with lots of clots or dizziness or like issues that maybe don't make sense on a Western level, but for us gives us more information. And as we can make those periods better and those ovulations stronger and regulate their system and become more healthy, that's a sign for me that we're doing the right thing and prepping them for a healthy pregnancy. I recommend it to anybody that has major health issues, or I would say mystery illnesses or unknowns. Definitely acupuncture is a great thing to do for people that have any issues related to fertility, whether it's advanced maternal age and egg quality issues, lining issues, uterine factor, also male fertility if the sperm is having issues. Herbs and acupuncture in about 2 to 3 months can help regulate that and improve the chances of not only a pregnancy but not having a miscarriage, and having, I think, because of epigenetics, having a healthier and happier baby in the long run. So if it's an egg quality issue, if it's a lining issue, if it's an ovulatory issue, if it's a hormonal issue, there's specific foods and strategies that we can use, going over their supplements. There's a lot of new supplements today that can help, but a lot that could hurt. So we need to know what patients are taking because they might actually be hurting themselves when they could be getting pregnant more quickly. Preconception care is pretty helpful. It's not just sort of coming in and like changing your diet for 2 weeks and getting acupuncture and jumping into the process. It's really taking care of yourself for getting that egg prepped and getting your body prepped and just optimizing fertility as much as possible so that if you do decide to do IVF, your chances and your outcome are going to be better. It's good to get educated and know the stats and know the science behind it. And then it's good to, I think, have cautious optimism. That's the best word for it. Having a realistic perspective and a realistic expectation, but then if you really want to do it, commit to 3 months of preconception care and really optimize everything as much as possible so that you have higher chances.